much. And at the onset, I'm very much thankful to Sharda Jain madam. Actually, when she always says, like a mentor, then it is a responsibility actually I feel on my shoulders that I should talk with very much responsibility. And the word, whatever I use in front of her, it should be very authentic and it should be based by the science. So thank you very much, madam, for that honor. Also, I am thankful to all DGF chapters for inviting me today and for coming here to hear this presentation. Everybody knows that actually when we met in Delhi last time, it was a pain by Sharda Jain madam, and she said that ki, Dr. Saab, we started this program of Anemia Mukt Bharat so many years back, but still we are there only, and everybody is feeling like that. Ki, Are anemia to ye roj ka hai, and we all are there, like we are feeling that we are stuck somewhere. So can we do something for that? And then after her great talk on GDM in API, there actually she shared with me that she was given a great remark by then API president, okay, madam, what you said is an oversimplification. And she liked that word. And then she said, okay, Dr. Gorakh, can we do something like that? And that's why today we are here with this topic, that is Anemia Mukt Bharat, oversimplified. I have tried to take it in a very, very crisp manner, like I have given the message before on justosis. So we all know that Anemia Mukt Bharat is our dream. And that's why we have come together. Okay, because we all know that anemia is a culprit, is a source for all infections, all the great obstetric syndromes whenever we discuss our subject. So ये सबकी जड़ है. So if we try to combat this anemia in a perfect manner, I'm damn sure that rest all the things, they will become easy. And why I told Madam Sharda that I will be talking on this, the reason because I practiced all these methodology in my practice, medical practice, in last 16 years, and I am very much proud to say that from my practice, I have, now the further sentence is very responsible sentence, I have eliminated the anemia in my patients. Number two, I have eliminated almost this justosis, and I have eliminated the fungal infections in my practice. And since last 16 years, by practicing some of the tips which I am going to share today. And this is an approach, and that approach is, it is a stiffer India. So if we use this stiffer India approach, then definitely we are able to combat this anemia, because just doing hemoglobin, initially it was told to do hemoglobin or to screen all the pregnant women by doing hemoglobin in all 3 trimesters. But later on we came to know that it is not only hemoglobin which is sufficient, but it is a complete blood count, because it is the blood indices which will give us the clear-cut idea that actually my patient is suffering from which type of anemia. But later on, in our practice, we realized that many a times, nowadays, almost, even I work in a very small place, madam. My population of my town is 60,000. So it is that small town. And there I practice. And but here again, we have so many machineries nowadays, so many laboratories nowadays. And then I thought, It is the machines which are making the mistakes and probably that is causing the problem. So, peripheral blood smear is the important entity that we have forgotten in our PG days. We were told to do the PBS and see under the microscope. And now that art has gone. So, if we bring back that art, then yes, all the tip of iceberg cases, and what I will say, all the tip of the iceberg of the cases, we may dig up and treat them. So we have to screen all the patients. In fact, I have written here screen all. Whatever, if any patient comes to us, maybe in adolescent age, maybe for gynecology, maybe for fertility, and especially in pregnancy, we have to screen all the patients by doing CBC and PBS. Here, the objection may arise that are we wasting the sources? I will say no, we are not the wasting resources, but we are investing the resources for the correct, effective, and prompt management of anemia. Second, immediately, I'm going to share one chart, and after that chart, then you all will realize, oh, if we follow that chart, no single case remains of the diagnosis, even without the help of a hematologist or a physician. So, first, I think I will share that chart and then we will go with the diagnosis. This is a schematic diagnosis of the anemia. And this one chart, if everybody has there in their OPD, but that's it. So, whenever any patient comes in front of us with hemoglobin less than 11, we have to see only one indicator, and that indicator is MCV, because it is the mean corpuscular volume, it is the cell size that is going to give us the clear cut idea of what my patient is suffering from. Whenever patient comes with low MCV, that is less than 80, we know most of the cases they are of iron deficiency anemia. Very few cases they will be of thalassemia or hemoglobinopathies. Few cases will be of anemia of chronic infection, or very rare cases will be of sideroblastic anemia. Just by understanding my patient's MCV is less than 80, I can come up with this much diagnosis. Now, when we are suspecting, I will suggest only two things to do, though many things are written here, and I suggest only to do serum ferritin and TIBC, because the two investigations which are sufficient, no necessity to do serum iron, no necessity to do percentage transferrin, only to do serum ferritin and TIBC. I am open for discussion at the end why I have chosen these only two investigations. The reason behind it is whenever we have ferritin less than 30, it shows us it's a clear-cut case of iron deficiency anemia. So with CBC, PBS and ferritin, we have got the diagnosis. We can counsel our patient that unless until your iron stores get fulfilled, you should take the treatment. And then only it will be the treatment forever or your anemia will get corrected. In that case, patient will present with low ferritin and high TIBC. Second population which may come up in front of us, that will be the ferritin may be normal or more than 30, but this TIBC that will be normal. And usually these cases are of thalassemia or hemoglobinopathies. Straight away, we can tell our patient that yes, the ferritin is normal. You have to undergo hemoglobin HB electrophoresis. But here again, in this stiffer India approach, I have recommended that do HB electrophoresis only by HPLC method. and no other method should be used, because no other method is perfectly all right. It is not going to give us the diagnosis of all hemoglobinopathies, all best possible hemoglobinopathies. They will be diagnosed only with HPLC. When I searched what will be the cost at private hospital level, at our hospital I am talking, we are getting at 500 or 600. So if we do the mass scale, definitely we can reduce the cost, but it will give us the diagnosis of all types of thalassemias, all types of other HBS and many HBD, Punjab, every variant. So HB electrophoresis by HPLC. Now third category of the patient, they will be of ferritin will be low or normal, but TIBC will be low. The total iron binding capacity, it will be low. Straightaway diagnosis should stuck to our mind that my patient is suffering from either chronic liver disease or kidney disease or pituitary disease, and this is an anemia of chronic infection. So ferritin low or normal with low TIBC, diagnosis goes to anemia of chronic infection. And now remains the last case where patient has come up. We have seen that MCV is less than 80, but her ferritin is normal and her TIBC is also normal. Now this case can be the case of sideroblastic anemia, and if we are in suspect, only one thing we can do is do serum iron. If it is high, it is a straightaway case of sideroblastic anemia, and we have to start deferoxamine B12, and patient will be come out. She will come out of the anemia. So with only one diagnosis, so with one only test, that is CBC, along with that PBS, and later on ferritin and TIBC, we are coming out with this much of the correct diagnosis, and later on, if required, HB electrophoresis by HPLC. If required in case of diagnosis of sideroblastic anemia, serum iron, we can pinpoint the diagnosis. Unnecessarily, wastage of the natural resources is also saved here. Now coming to the second part of the chart. This is a second part of the chart. When HB is less than 11, but MCV is high, more than 80, more going towards 100, then I have recommended only one investigation, and that is retic count. Already we have PBS in our hand. So while seeing that PBS carefully, our pathologist can tell us that, oh, on PBS, there is a presence of cystocytes. There is presence of microspirocytes. So if the cystocytes and microcytes are present, probably it is a case of hemolysis. So by just looking this picture of MCV and PBS, one can go to this much high diagnosis of either intravascular or extravascular hemolysis just by looking PBS and CBC. Now here if we want to pinpoint the investigation, whether my patient is suffering from B12 and folic acid deficiency, are we going to recommend to do the serum B12 and serum folic acid? I will say no, because each test cost almost 1200 rupees. We do not want to give that. Straight away we can do a reticulocyte count. So if the retic count is less than 2 or 3, it is a case of B12 or folic acid deficiency. And if it is more than that, it is a case of either it is a hemorrhage, or it is a extravascular hemolysis, or it is a intravascular hemolysis. How to differentiate in that? When microspirocytes are absent, it is a hemorrhage, and hemorrhage will be obvious there. But if the cystocytes and microspirocytes are present on the PBS, either it is intravascular hemolysis or extravascular hemolysis, as I mentioned, by doing just LFTs, we can pinpoint the diagnosis and send the patient to the expert. Another thing, there can be another diagnosis with a low retic count, and that can be either bone marrow, that is a plastic anemia, or the myelodysplasia. But please, we have to keep in mind, along with CBC, we are getting total WBC count. Along with CBC, we are getting total platelet count, and we are looking the PBS. So only with these first line, we can come to that direct conclusion that probably my patient is suffering from aplastic anemia or myelodysplasia, and straight away we can take the help of hematologist and jump onto the bone marrow studies with their help. So if we follow this much chart, can we minimize the anemia? The answer is yes, yes, and yes. The first phase of diagnosing the correct anemia with the minimal investigations and without the help of hematologist or a physician, we can jump onto diagnosis, pinpoint the diagnosis, and send our patient to the correct expert and get done the treatment. So this I wanted to show. This is a schematic diagnosis of anemia. So coming back to our chart, again I will say screening all by CBC and PBS, TIBC and ferritin for all with MCV less than 80, that means hypochromic microcytic, electrophoresis by HPLC only, where we can diagnose all better types of hemoglobinopathies and abnormal hemoglobins, retic count for all with MCV more than 100. Now this is stiffer, and now coming to India. So this is the second part where we have to be very much aggressive in treating the anemia. First of all, one must have to be very clear in our mind that what we are dealing with. If my patient's hemoglobin is more than 11, I am dealing with a normal patient or non-anemic patient, and I am using the iron or whatever my advice is only for the maintenance of pregnancy, or what we call it as a adjunctive. But if at the moment my patient's hemoglobin is less than 11, I am dealing with a patient of anemia. So my dose will change, my advice will change, everything will change. And that's why I have written purposefully here that injectable for all moderate and severe anemia. Here the questions may arise, but our own anemia Mukt Bharat operational guidelines by Government of India, Dr. Sharda Madam was a part of it. They have said that, and it is yes, it is beautifully explained that injectables are safe. Only thing in late second trimester onwards. But we have to be now rely on these injectables. Effectively, we should use injectable for all moderate and severe anemia. We should not hesitate. Now, there is a question, which injectables? Again, one thing we all should keep in our mind. It was the dextran component of the injections that was anaphylactic. Nowadays, FCM doesn't contain dextran. Isomaltose doesn't contain dextran. So because they do not contain dextran, no anaphylaxis. So we have to rely on them. Again, I'm going to show that app which I have prepared. Then also we get a clear idea to which injection to use, how to use, and if we have ready reckoner in our hand, it becomes very easy, and also it becomes very easy to counsel our patient. So this is India ka in. Next is D. Deworming of all OPD patients. Madam, I am proud to say I just calculated that data in our hospital. Madam, we have given these deworming tablets. I am saying non-pregnant patients. Pregnancy ka to alag hai. But in non-pregnant patients, I have given these tablets to 18,126 patients. And not only patients, but their relatives. Even any medical representative comes in our OPD, we give them deworming tablet. So that is a rule that whenever any person comes in our OPD, I give them one albendazole tablet. Only we ask, are you pregnant? If she says yes, then after 28 weeks, at 28 weeks. But if she is not pregnant, then all my relatives, all the attendants, even all visitors, anybody comes to my clinic, he has to take not a cup of tea, but one deworming tablet. And in last 6 years, we have done, madam, 18,126 persons we have done this deworming. And I have seen this approach because if we go into the literature and if we see the infectious disease ka jo bhi, whatever the gadget has come, it has shown that in Indian population, especially the northern Indian and western Maharashtra populations, ankylostoma duodenal is a habitat. And because we all are farmers, and because of that, it is going everywhere. And we all know it is the nails which are the richest source of harboring it. And all our women, those who are preparing the food, they are actually spreading this. And that's why I have done this deworming for all. And once we get done, I think, and that's how I feel that in my practice, I am going away from the anemia. Next is about oral iron. We are always confused because many a times it happens that any patient comes in front of us and we write him or her X timba timba X tika tablet, only one tablet. But is it sufficient? The answer is no, because we are not giving the prophylaxis of pregnancy, but here we are treating the anemia. And whenever we are treating the anemia, the dose given by WHO is 120 milligram, while by Indian government the dose given is 200 milligram. So that means the patient has to take 2 tablets. That we are forgetting, and that's why we are under treating the anemia. And what we do? We always say, I have prescribed her the iron. She is taking since last 2-3 months. Probably she is not digesting it, or there is no bioavailability, etc. No, we are giving underdose to her. So it is our duty that iron orally to be given 200 milligram in the treatment. Then somebody may stop me and ask me कि क्या कभी आपने खुद खाके देखी है कि 200 मिलीग्राम आयरन खाओगे तो क्या होता है? Yes, and that's why another recommendation what I am going to make it here, it is the salt of the iron that we have to use. And number one salt which I have observed in my practice, which is easily palatable by all the women, number one, I am seeing palatability, acceptance is ferrous ascorbate. Whatever curse we may give, I am not saying that it is the highest absorbable iron. If you ask me, the answer will be ferrous sulfate. But I am talking most accepted and most palatable iron, oral iron format, it is ferrous ascorbate. Second, ferrous glycine sulfate. Third, carbonyl iron, and then rest of the things. So if we use this or even ferric carboxy maltose के जो जितने भी oral iron formats है, so all these are the complex formats are palatable as well as acceptable, and that's why we have to use such tablets. Another important thing, because it is the second last point, so I want to stress here, we have to talk with our patient. That, see, there are 3 tablets where we have to talk. One tablet is, number one, it is iron tablet. Second tablet, tinidazole. And third tablet, OCP, where we have to talk with our patient that these tablets are going to cause hyperacidity. If we convince them, then at least maximum headache goes off. We have to tell our patient, number one, this tablet is going to cause hyperacidity. It may cause flatulence. It may cause little diarrhea, but you should not stop the tablet. Please continue with this tablet for 3 or 4 days, and after 3 or 4 days, all the symptomatology will get settled. If it doesn't settle, please come back. I will change the formulation. But in 70 to 80% patients, madam, all this symptomatology gets settled. We have written record. What we do is we keep a notebook in our medical, and my medical की जो मेरी medical की जो ताई है, she always ask the patient कि ये अगर आपको हजम नहीं होता है तो इसी मेडिकल में वापस लाके दीजिए, मैं सर से आपको फॉर्मुलेशन चेंज करवा के दूंगी. And we have seen in last 3 years that only 10 or 12 patients they have came back and they have asked कि ताई ये हमें बदल के दो. Otherwise 90% of the patients with ferrous ascorbate they have accepted, they are continuing, they are taking, purchasing again and again. Even we have a record of purchasing the iron tablets for 9 months. So this is how I know that my patients are accepting it and it is easily palatable, and that's why I am making this statement on the experience and not it is not a sponsored statement. The last thing, very important thing, what I tell always to all my patients, that please they take this iron tablet with nimbu ka sharbat or nimbu ka pani, because we all know that iron palatability, iron absorption is raised with ascorbic acid. इसीलिए तो हम जब पोहा खाते हैं तो उसके ऊपर नींबू लेते हैं. नींबू के ऊपर जो पोहा डाला जाता है, the reason behind it is the same, to increase the absorption of the iron. But again we are doing one mistake, that पोहा के बाद हम चाय पीते हैं and टैनिन का चिलेट और ये पूरा का पूरा आयरन चला जाता है. And that is the how we always counsel our patient that please take this tablet with नींबू का पानी. खाना खाने के बाद एक छोटा सा नींबू का फोड़ लीजिए, पानी में डालिए और उसी के साथ ये टैबलेट लीजिए तो अच्छा हजम होगा. और ये टैबलेट के साथ कैल्शियम की गोली नहीं खानी है, और कैल्शियम की गोली शाम को खाइए, वो थोड़े से दूध के साथ, तो हजम अच्छी होगी. So that if we talk this again and again, and this is not only me, but even my nurses, even my counselor, and even medical wala says the same. So whenever we use everybody uses the same language, then it becomes एकदम stout in their mind कि ये टैबलेट नींबू पानी के साथ और कैल्शियम की टैबलेट दूध के साथ, और ये दोनों टैबलेट एक साथ नहीं खानी है, और कुछ भी हो जाए 4 दिन तक छोड़नी नहीं है. So whenever we utter this, we have seen that there is a great acceptance. And the last thing, we all know hemoglobin. It is heme and globin. It is the maturation of the RBC. So whenever there is anemia, we have to add all the adjuncts. So it is not only iron sufficient, we have to add folic acid, but here again the dose required of the folic acid for the RBC maturation is 1.5 milligram. There is no need of adding that 4 or 5 milligram ka full tablet. And that is the reason in first trimester the folic acid which is given is 4 to 5 milligram. But on second trimester onwards, all the iron tablets, they are with folic acid 1.5 milligram or less. That is the reason. Second, vitamin B12, again for the RBC maturation, and the very important thing is protein. I always say 2 eggs a day. 2 eggs a day in throughout the pregnancy, no justosis, no anemia, no IUGR, no oligohydramnias, nothing happens. 2 eggs daily of poultry. Only I come across some Brahmin people, some Jain communities, or some of the people who say that, "Okay, doctor, we do not eat this." So they are eating one katori, but that is again a big katori of almost 100 gram. उसल को क्या बोलेंगे? Sprouts. So pakaya हुआ sprouts. So they have to eat thrice in a week. So that much protein should be given to them. I never recommend protein ka powder, because if you agree, if you read the protein powder ka dabba, each dabba serves with 100 gram of the powder almost 40 gram of the carbohydrates. So probably it is the protein ka dabba which are causing GDM. It is the protein ka dabbas which are causing unnecessarily big babies. So we have to be very careful, and we have to advise the edible protein, and that to first preference in the form of 2 poultry ka egg. Again, now I have started counseling all my women that poultry ka eggs, they are non-biological. माने उसमें तो कोई नहीं है, तो आप बिंदास खाओ. मैं तो हंसते हंसते उनको बोल भी देता हूँ, अरे मुर्गी क्या, आप भी उस पर बैठोगी तो कोई नहीं आने वाला उसमें से, तो आप बिंदास उसे खाओ. तो ये भी बोला, तो मेनी पीपल दे हैव स्टार्टेड ईटिंग दोज पोल्ट्री के एग्स. सो व्हाट आई फील, if we use this approach, that is stiffer India, I think the जो ड्रीम है मोदी जी का, हम सब का, शारदा मैडम और ये सब सीनियर्स का, हमारे टीचर्स का, एनीमिया मुक्त भारत, ये तभी होगा if we use this approach, and that has to be aggressive approach. So I repeat, screen all by CBC and PBS, TIBC and ferritin for all with MCV less than 80, that means microcytic hypochromic, electrophoresis by HPLC method only, retic count for all with MCV more than 100, that means all megaloblastic anemias, injectable iron for all moderate and severe anemia, deworming of all OPD patients, irrespective of pregnancy and nothing, iron orally to be given 120 to 200 milligram in the treatment of anemia, and one should not use the haphazard half-hearted doses. And don't forget proteins, folates, vitamin B12, and प्यार भरा advice कि how to eat, what to eat, and what not to eat. The last slide I wanted to show is of otherwise I will go on my app, so that at the so once everybody understand this app, then probably everybody will understand कि अरे how to discuss about the diet. Now I am going there on my second phone. Here also am I audible?
So disturbance आने लगा. You will have to log out now.
Now there won't be.
Yes, sir. Echo आ रहा है. बहुत echo आ रहा है.
एक सेकेंड दीजिए मुझे. Now नहीं आ रहा है.
Yeah, it's gone now.
Yes, मैडम अभी नहीं आ रहा है.
Yes, there are, no disturbance.
Disturbance नहीं है.
Yes, better, sir.
Yes, now I am audible. Right.
Yes.
So now I want to show one app, and that app is Cross 11 app. This I again prepared based on the Anaemia Mukt Bharat operational guidelines, and this was inaugurated by then Sripadji Naik and Dr. Yes, madam.
पीपीटी भी नहीं दिखा रहे, अभी पीपीटी नहीं दिखा रहे.
हाँ मैडम, अभी एक सेकंड में दिखा रहा हूँ, एक दो मिनट में दिखाऊंगा. तो ये भी वापस मैं जाता हूँ पीपीटी पे, शेयर द स्क्रीन, कंटिन्यू. start now. मैडम मेरा स्क्रीन अभी दिख रहा है?
Yes, we can see your cell phone screen.
Right. Madam, this is a Cross 11 app.
Okay.
Am I able to see? Are you
Yes,
able
sir.
to see?
Yes.
Yes.
Yes. This was inaugurated at the hands of Sripad Ji Naik, who was then Central Health Minister at that time during the COVIDs. And this is again based on the Anemia Mukt Bharat guidelines. It is an easy reference for the diagnosis and management. See, when we go on this app, this is Android app, there is first button that is called as, before that I will show the home screen. When we touch this about, this shows that 32.4 million pregnant women suffer from anemia, etc. And lastly, it is written that to serve this purpose, Mandrupkar Clinic Center for Health Skills, Islampur district, Sangli, has developed this mobile app in the service of nation to Anemia Mukt Bharat. It is available free of cost. So we are not charging anything. Now we start this app. If we put the button start, this picture comes in front of us. हमारे सामने CBC का रिपोर्ट है and now we have started the app. So बस हमें क्लिक करना है MCV पे, तो सामने आ गया लो MCV और हाई MCV. अभी लेट अस स्टार्ट विथ लो MCV. तो आई एम क्लिकिंग लो MCV. तो वो पूछता है कि ये पेशेंट का फेरेटिन क्या है और TIBC क्या है, जो मैंने आपको फॉर्म बताया कि हर एक पेशेंट का, हर एक MCV लेस वाले पेशेंट का हम फेरेटिन और TIBC करेंगे. तो हमने उसे क्लिक कर दिया. तो ये बोलता है कि ये 4 पॉसिबिलिटीज है. अभी आपका पेशेंट क्या है? तो लेट अस सी, मेरा पेशेंट पहले वाला है, फेरेटिन लेस देन 30 और हाई TIBC. हमने क्लिक कर दिया तो ये ऐप बोलता है कि योर पेशेंट इज आयरन डेफिशिएंसी एनीमिया. नाउ ऐप आस्क्स मी व्हाट इज द लेवल ऑफ एनीमिया. I click it, then it comes mild, moderate या severe. अभी मैं आपको पूछूंगा कि मैं कौन सा सिलेक्ट करूं. वंदना मैडम, मैं
Severe.
कौन सा सिलेक्ट करूं?
Severe. Severe.
मैंने सिवियर क्लिक कर दिया तो उसने मैसेज दिया, सिवियर एनीमिया रिमोट फ्रॉम द टर्म कैन बी मैनेज विद पेरेंटरल आयरन प्रिपरेशंस. PCV transfusion is indicated in severe anemia with without decompensation, with without signs of cardiac failure and or hypoxia or failed parenteral iron therapy. So पहले आप parenteral iron therapy दे सकते हो if you are removed from the term. That is the advice based on Anemia Mukt Bharat guidelines. फिर किसी ने पूछा कि what are the prerequisites. हमने उसे क्लिक कर दिया तो ये बोलता है diagnosis of health facility must have adequate supervision and facilities for the management of anaphylaxis. And oral iron should be stopped at least 24 hours prior to therapy to avoid the toxic reaction. That is the main recommendation. फिर पूछेगा contraindications क्या है. हमने क्लिक कर दिया तो आ गया first trimester of pregnancy. It is a contraindication. Will not use parenteral iron. Second है history of anaphylactic reaction and chronic liver disease. चलो ये भी नहीं है. देन मैडम विल आस्क व्हाट इज द कैलकुलेशन ऑफ द रिक्वायर्ड डोज. चलो क्लिक कर दिया. अभी हमें सिर्फ पेशेंट का HB डालना है. वंदना मैडम, क्या है आपके पेशेंट का HB सीवियर एनीमिया की?
7.
हमने 7 डाल दिया. और आपके पेशेंट का वेट क्या है?
Weight would be 54.
ओके, हमने डाला 54. सॉरी, नीचे प्लीज एंटर द वेट. तो इसमें हमने डाला 54. हमने लगाया कैलकुलेट द डोज. आ गया आयरन डोज.
Okay.
So the dose has come as 1648. अभी हम आपको पूछेंगे मैडम आपको क्या देना है, सुक्रोज देना है कि FCM देना है?
FCM.
FCM देना है. हमने FCM पे क्लिक कर दिया तो ये बताता है कि कैसे हम इन्फ्यूजन की ड्रिप तैयार करें. 200 to 500 अगर हमें देना है तो that is to be diluted with 100 ml of the normal saline and important thing given over 6 minutes. If we are too slow, we are causing the damage. अगर हमें 500 to 1000 देना है तो we have to dilute it with 250 ml of the normal saline and we have to give it over 15 minutes. और लास्ट में ये बोलता है कि schedule can be made to give not more than 1000 milligram in a week till total dose is achieved. So it is a very simplified thing. इसी के साथ साथ जो मैंने बोला कि कभी भूलना नहीं है, दैट इज एडजुवेंट थेरेपी, टी-वर्मिंग विथ एल्बेंडाजोल, B12 and folate supplementation, protein diet and supplementation. So this is how, sorry, 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 sorry. This is how we, now we are going again to home. So I am not showing all the
सर म्यूट हो
small
गया,
things,
सर म्यूट हो गया
but
आपका।
this I have just shown about the iron deficiency.
Right.
Okay, sorry. Now am I audible?
Yes, yes, yes.
Okay, sorry. Now I will show another one example of high MCV,
Right.
and then rest of the things you all can see on your app. So start. Wapas, I am clicking on MCV.
Right. Hi.
Now high MCV. Now this MCV is normal or more than 80. I have already said that kindly look for retic count. PBS तो हमने already कर दिया. टोटल WBC और प्लेटलेट काउंट तो हमारे CBC के साथ मिल गए, तो ये जाके बोलेगा ये 4 पॉसिबिलिटीज आ जाएंगे. The first possibility, reticulocyte index less than 2 and macrocytes on PBS.
Right.
तो ये सीधा क्लिक कर दिया, ये बोलता है डायग्नोसिस इज B12 एंड फॉलिक एसिड डेफिशिएंसी, बस. सो हमने सेकंड एडवाइस दिया है कि असेसमेंट ऑफ B12 एंड फॉलिक एसिड इज कॉस्टली दैन द ट्रीटमेंट. So, and parenteral therapy is promising, followed by oral treatment for the maintenance. Means हमने ये भी बता दिया कि B12 अगर देना है तो it is parenteral route, क्योंकि टैबलेट B12 देते रहेंगे तो साल भर खाना पड़ेगा. So this is how this app gives. Another last possibility is low or normal retic index and low WBC. तो ये बताता है कि पेशेंट विल रिक्वायर एक्सपर्ट हिमेटोलॉजिस्ट मैनेजमेंट. आप मत देखो इसे. पेशेंट में भी असेस विद बोन मैरो स्टडी, तो तुरंत उसे आप रेफर कर दो. तो दैट मीन्स दिस पब्लिक हेल्थ अप्रोच इज ऑल्सो केप्ट इन दिस ऐप, दैट दिस पेशेंट इज नॉट यूर, आप भेज दो उसे आगे. एंड द लास्ट ब्यूटी ऑफ दिस ऐप, एंड देन आई विल स्टॉप माई टॉक, दैट इज डाइट डिजाइन. एंड दिस डाइट डिजाइन इज वेरी इंपॉर्टेंट. आई हैव रेफर्ड फॉर दिस. मैडम गोपालन सर का जो अपना ICMR का जो चार्ट है, तो गोपालन सर का ही इसमें मैंने यूज किया है. आई हैव टेकन परमिशन फ्रॉम यू, राइट. सर से बात करके किया हूं. तो दिस इज वन. मैडम वी ऑलवेज से कि बीट खाओ, फिर हम बोलते हैं गुड़ खाओ, फिर हम बोलते हैं खजूर खाओ. मैंने बहुत सारी एडवाइस हम देते हैं जो कि गलत एडवाइस है. बिकॉज हियर आई वॉन्ट टू शो यू दैट फूड रिच इन आयरन कंटेंट मिलीग्राम पर 100 ग्राम. अभी यहाँ पे सामने दिख रहा है. मैं आपको खजूर का पहले दिखाता हूँ. मैडम ये खजूर कहाँ पे दिख रहा है हमें? अभी नहीं, अभी नहीं, अभी नहीं, नहीं 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 नहीं, ये आ गया खजूर.
7.3.
अभी भी नहीं, अभी भी वो जो ड्राई आया, अभी भी नहीं, अभी भी नहीं, अभी भी नहीं. तो ये माने जो वो वेट खजूर है वो तो इसमें आया ही नहीं. तो जो ड्राई खजूर आया ये तो इधर आया.
7.3 dates dry.
तो इट इज दैट लेस. तो हम क्या बता रहे हैं? हम गलत बता रहे हैं एडवाइस. फिर हम बोलते हैं कि आप ये खाओ, मटन के मसल्स खाओ, उसमें से आपको बहुत सारा आयरन मिलेगा. कुछ नहीं, इट इज 2.5. वी हैव टू ईट दैट, बट दैट इज फॉर डिफरेंट सोर्स. हम जब आयरन डेफिशिएंसी की बात कर रहे हैं तो हमें यह नहीं बोलना चाहिए. फिर बीट रूट. मैडम बीट रूट का तो सबसे कम है 1.19. हमारे गाजर का तो सबसे कम है 1.03. तो हम पेशेंट को आयरन डेफिशिएंसी के टाइम जो एडवाइस दे रहे हैं वो गलत एडवाइस दे रहे हैं. तो क्या खाना चाहिए? सर बोलते हैं ये खाना चाहिए, हलीम. हलीम या हलीव जिसके लड्डू होते हैं. हाँ, ये छोटा छोटा होता है. इट लुक्स लाइक जवसला काय म्हणायचं, फ्लैक्स सीड जैसा ये छोटा छोटा दिखता है हलीम. दैट इज वेरी पॉपुलर इन आवर एरिया, पॉपुलर इन उत्तर प्रदेश. उसके अच्छे खासे लड्डू बनते हैं. सेकेंड, लोटस स्टेम ड्राई, नाइगर सीड्स, कॉलीफ्लावर ग्रीन, माने जो हम कॉलीफ्लावर का फेंक देते हैं, दैट इज द रिचेस्ट सोर्स. और हम खाते हैं गड्ढा, और बाकी का जो फेंक देते हैं दैट इज द रिचेस्ट सोर्स ऑफ आयरन. देन देखिए अमरैंथ स्पीसीज माने चाकवत, पोकला, माने अभी राजगिरा, ऑल दीज आर द थिंग। राइस फ्लेक्स, पोहा खाना चाहिए, लेकिन ये पोहे पे नींबू पानी होना चाहिए और उसके साथ चाय नहीं पीना है, तभी ये पोहा से हमें आयन मिलेगा। तो व्हाट एडवाइस वी आर गिविंग दैट वी हैव टू थिंक हियर। आई हैव प्रिपेयर दैट कि अगर हमें वेजिटेरियन सोर्स चाहिए तो ये आएंगे, अगर हमें पल्सेस चाहिए तो मैंने ये कहा है, माने वी हैव टू सिलेक्ट, वी हैव टू टच द कैटेगरी हाई टू लो या लो टू हाई, एंड डिपेंडिंग अपॉन दैट वी गेट ऑल दिस थिंग्स। तो पेशेंट को अपना अपना डाइट का डिजाइन मिलता है। So this is how, and the name which is been given to this app is Cross 11. कैसे भी करके 11 को क्रॉस करो, that is Cross 11. And another thing which is given in this app, सबसे नीचे मैडम देखिएगा, that is read more. और वहां पे दिया है, these are the two guidelines. One is एनीमिया मुक्त भारत, जो अपनी गवर्नमेंट ऑफ इंडिया की गाइडलाइंस है, और लास्ट है फॉक्सी GCPR बेस्ड ऑन एनीमिया इन प्रेगनेंसी। सो अगर हम इसे क्लिक करते हैं, मैंने क्लिक कर दिया, स्ट्रेट अवे वी आर डाउनलोडिंग दैट PDF। तो दैट मीन्स पेशेंट को हम बोल सकते हैं कि बाबा मैं जो भी आपसे बात कर रही हूँ दैट इज एविडेंस बेस्ड। सो हमारी जो प्रोफेशनल ऑर्गेनाइजेशन है वो भी यही बोलती है, और हमारा जो गवर्नमेंट ऑफ इंडिया है वो भी यही बोलता है। तो व्हाट एवर आई एम टॉकिंग दैट इज absolutely evidence based. So this is, I feel, the anemia मुक्त भारत। अगर इस प्रकार से हम इसमें चले गए तो आई थिंक वो दिन दूर नहीं कि जैसे शारदा मैडम हमेशा बोलती है वी हैव टू बी ऑलवेज पॉजिटिव। मैंने मुझे उनकी तरफ देख के तो मैंने आई गेट ऐसा चार्ज किया, अरे yes, we can do something, and for this he has inducted many thoughts in my mind. मैं झूठ नहीं बोलूंगा, my wife is sitting here, मैं आज 3 बजे से उस पर सोच रहा था कि मैडम के सामने, आप सब लोगों के सामने बात करनी है तो मैं किस प्रकार से बात करूं, एंड देन दिस स्टीफर इंडिया का अप्रोच आई गॉट स्टक. And I think that is the approach what we are using since so many years, and we all should use, and probably we will get anemia mukt Bharat. So thank you very much again for patient listening. I may be wrong in many concepts. You all can correct me. And thank you very much, Sharda madam, always for blessings and inviting. Thank you very much, all of you.
Gorakh, you've made me proud. You made me proud. In fact, exemplary talk. Like you, I also can boast that, I don't see anemia now in my practice. But I think the way you have charted it, it is just super simplified. Super simplified. And I think, everybody goes with the messages. And your things are very clear. Stiff for India. India is for treatment, and as for the stiffer is for your workup. Just superb. And I am really thrilled at the end of the things of your diet components. What we have been teaching for a long time, it is not true, and now we need to change as far as diet counseling is concerned. Because I also feel that beside investigation, beside giving treatment, you need to talk to your patients. And if you talk to your patients, and I add a little bit more also, that IQ of the child is decided by the hemoglobin of the mother. And if you want to make your child Abdul Kalam, and then you have to have your hemoglobin. I say not 11, I say 12 hemoglobin should be there at the time of your delivery. Then you will sail through. And I lost my mother when I was 6 years old. You will not lose the life, and things will be great. But I think you have made our life much simpler. 41, 42 people listen to you, and I think they will be ambassadors for you, or they'll be listening 1 or 2 more talks of yours when you're doing in other forums. So they will be absolutely 100% clear. So I think now I will ask the other colleagues of ours to make a comment what they felt about it. but it was amazing, amazing. So that's what I can say.
Thank you, ma'am. Dr. Sangeeta Gupta, are you there?
लीना आप शुरू करो, लीना आप शुरू करो.
Ma'am, this was an amazing talk, and I mean, I was expecting something like this, but I never thought it was going to be so mesmerizing. Having heard Dr. Gorakh before, also, there's so many things we have come to know. I mean, I never knew about Halim, that you mentioned that it is top on the list,
Yeah.
and you know, it's completely now you know, going to change the way we talk to our patients. And like ma'am said, yes, in a private setup, we have been able to bring down anemia, but this, the way you have mentioned, it is so simple. I think, you know, it's so easy for anyone to catch on in their practice. Now, what I just wanted to say was, you know, what I found so wonderful in this app was, you know, the easy way in which you mentioned how to give the parenteral iron. Even now, despite having, you know, people, our residents, everyone around, we still have to keep on emphasizing how to give parenteral iron, because, you know, somewhere down the line they feel 6 minutes bahut you know, fast,
Sometime.
and you know, it's there in their mind that we're going to have a reaction. So it takes so much to explain to them that you are going to do no benefit if you're going to give it slow. So, you know, reiterating all these things and then having it in an app which is so accessible, so easy for anyone to use, I think that is really, really wonderful. And what you mentioned about, you know, proteins and people using protein powders. I see so many patients coming referred by various doctors. Everyone is giving them protein powders. And you find that women are quite, you know, overweight. The babies are overweight, but they are anemic. So actually, you know, somewhere down the line, we are not stressing on dietary sources of protein, thinking that, you know, people are not taking enough protein. We just have to redirect them to take the right things. So I think it was so beautiful. Everything, I mean, I just can keep going on, but I think I should have other people also putting in their valuable comments. So thank you very much. And I really want to get this app and download it in my phone here right away.
Yes, thank you.
Dr.
Thank you,
Vandana.
Dr. Luna.
Yeah, thank you, Dr. Gorakh. As it is, it's been very enlightening and wonderful, and really simplified for a user, so that you don't have to remember everything. You just have everything on the click of your hands. And one thing I just wanted to clarify, that ferritin levels at times are falsely high in infections.
Yes.
So that is the reason why we bank upon TSAT saturations,
Yes.
transferrin saturation levels,
Absolutely.
to differentiate. Yeah. So
Absolutely,
that is-
madam. Only
yeah.
thing why I have not mentioned the reason behind it is, when I thought of public health approach, for mass, then it will become cumbersome. Unnecessary, it will increase the cost. But definitely, you are absolutely right. Whenever patient is in front of us with infection, then yes,
We
we
need to
can,
decide.
we can. But it is not for all. That's
Okay.
why I thought.
Okay. Thank you. Thank you.
Kiran, Dr. Kiran Chabra.
The excellent talk and very take home clear messages you have given. Your app is also very, very simplified. Anybody can use it. I would like to ask you one thing, that you said that for B12 you have to give injectable. So how many injections we can give to a patient? Because I have seen sometimes that you give 5 injections at time, and then again after 2-3 months the patient is back at the same page. So
Correct.
what to do in such situations?
Right. Madam, what is recommended is we have to use 4 to 6 injections
Okay.
initially, and then we have to keep that patient at least for 2 to 3 months on oral therapy. And
Okay.
if the patient is again going in B12 deficiency, then we have to find out whether she has a liver disease or something. Because again, probably when she is going in chronic B12 deficiency, probably there is other disease which is causing all these problems. So we have to be in search of that as well.
Okay.
Sir, I'm also on the same page with you that injections आप दो, नहीं तो tablets में ले लो, सालों साल लो, कुछ कोई फर्क नहीं
Which
पड़ेगा.
होने वाला है. That is
So
it.
someone is asking, do you have an app for iPhone also?
Madam,
Yes,
we
I
are
would
in-
also like to know.
Anita Rajoria.
I will also like to know app for iPhone.
नहीं मैडम, आईफोन के लिए नहीं है,
तो
बट
सर नया
वी आर
फोन
इन प्रोसेस.
खरीदना पड़ेगा.
एक्चुअली हुआ ये है कि आईफोन के लिए जब हमने ऐप के लिए एप्लीकेशन किया, तो दे आर आस्किंग अस हाई चार्जेस. and this is my own, so that is a problem. But yes, we'll try to do it.
Yeah.
Anita ji,
Thank
Anita
you,
ji,
Gorakh sir. Thank you, sir. Stiffer India for Iron Ladies of India and children who are like Abdul Kalam. Thank you, ma'am, for highlighting that point. And one thing, most of the things have been reiterated by my colleagues. I just want to add that deworming is a simple strategy which can go a long way in prevention and during treatment of iron deficiency anemia. Despite all the things that we are having in GOI guidelines, we still are getting mothers who are less than 6 or sometimes 5. Most of them are referred cases from rural areas. So we have to strive hard to get to those mothers who are still severely anemic. And thank you for that app, sir. You have introduced it very well. We'll definitely ask our residents to download it, and it will go a long way in helping them. I keep on reiterating giving IV iron infusion because somehow we feel that our patients are very reluctant to come back for follow-up. So I feel very fine that the total dose iron is given and the diet is supplemented, B complex, and folic acid is added to their diets. And another important thing is protein. So whatever protein they can get hold of, it may be the cheaper sources also. Whatever they can take, I tell them and reiterate them to have it. Thank you
Yes.
so much, sir. Thank you
Thank
so
you.
much.
Dr. Renu Chawla, your comments are needed, and then we will take comments.
Dr. Gorakh, it was an excellent talk. And I think we are all wiser and we have so many good take home messages. But still, I think that diet has a good role. If we counsel the patients on natural diet and especially the protein intake, it is very important. Because वो डब्बा तो आधे लोग तो खाते ही नहीं है कि टेस्ट अच्छा नहीं है और खाते भी हैं तो as you have mentioned that it has lots of carbohydrates. So I think we should counsel them to have good dietary proteins. Thank you, sir.
Thank you. Thank you.
सर पीनट्स, भुना हुआ चना, दाल का चीला, बेसन का चीला, दाल का एक बोल, उबले हुए राजमा चने का सैलेड बना के खा सकता है पेशेंट. राजमा हो, चने हो, ये वाइट राजमा जो आती है, लोबिया, ऑल दैट विद लॉट्स ऑफ वेजीज. जी मैम,
इनकी डाइट देख लेना.
जी
इसलिए
मैम.
हमने एक यहाँ पे कंपटीशन लिया था. यहाँ पे एक रेडियो एफएम है, तो ये एफएम के रेडियो के साथ हमने एक कंपटीशन लिया. इन्हें बताया गया कि दीज आर द रिचेस्ट सोर्सेस ऑफ द आयरन. तो इससे आप ज्यादा से ज्यादा कौन कौन सी प्रिपरेशन बना सकते हो. एंड ऑलमोस्ट 60 पार्टिसिपेंट्स
मैंने कहा नहीं लग जाएगा.
और 60 में से हमने 20 उनको मैंने प्राइजेस दिए. एंड एज मैडम यू हैव सेड, उन्होंने वो भेल का दिया, फिर खीर के बना दिए, लड्डू बना दिए, और एक लड़की ने तो मेरे नाम से लड्डू बना दिया, दैट इज गोरख लड्डू. एंड दैट कंटेन्स
चौलाई के लड्डू कहते हैं सर यूपी में हम उसको. चौलाई के लड्डू कहते हैं. चौलाई के लड्डू बहुत अच्छे होते हैं.
हाँ, चौलाई के लड्डू बनते हैं. राइट.
चौलाई होती है वो यूपी में बहुत खाते हैं सर. इट्स सो वेरी इजी.
चौलाई के लड्डू
यू कैन स्टोर इट आल्सो.
गुड़ के साथ बनता है तो वो डबल इफेक्ट हो जाता है.
करेक्ट. तो मैडम इसमें भी इन्होंने
एक बात पूछनी है सर. ये जैसे कॉपर वगैरह, कॉपर, कोबाल्ट, दे आर सेड टू बी हेमाटोपोइटिक. तो वो आप ट्रेस मिनरल्स क्या मल्टीविटामिन के थ्रू ही सर उसको एनकरेज करते हो ऐड करने के लिए, या कुछ और सोर्स आप बताते हो? जैसे साइटोक्रोम के लिए आयरन चाहिए और कॉपर भी चाहिए, और हेमाटोपोइसिस के लिए भी चाहिए, थोड़ा सा कोबाल्ट और कॉपर चाहिए होता है. तो सर वो कैसे मतलब डाइट सोर्स से ही बताते हैं?
अनिता रजौरिया, लेट मी बी वेरी फ्रैंक. आप जितना उन्होंने किया उसको अगर आत्मसात कर लेंगे उतना ही बहुत है डॉक्टर साहब. हमें प्रोफेसर होके वो वाली चीजों में नहीं जाना है. जस्ट इतना ही इसको आत्मसात कर लो, यही बहुत है.
यस मैम, ये ट्रेस एलिमेंट्स बहुत जरूरी हैं, जो आई थिंक मल्टीविटामिन से मिल सकते हैं अगर पेशेंट के पास अवेलेबल है.
आजकल तो कॉपर वेसल्स में पानी पीते हैं लोग, तो
हाँ
that will also-
दीपशिका मैडम ने
डॉक्टर रेणु आप वाइंड अप करेंगे?
मैडम
जी,
दीपशिका
Gorakh, I
मैडम
will
ने
say it was a
हैंड
treat.
रेज किया
It was
है।
a treat to
Deepshika
all of us.
wants to ask something.
दीपशिका मैडम ने
Deepshika,
हाँ,
Reну.
एक्सीलेंट डॉक्टर गौरख, एज यूजुअल आपकी एक स्लाइड इतनी इंफॉर्मेटिव होती है. Take home message is very good as always. It was shocking to me that iron content is so less in
Beetroot.
beetroot and etc. One of my patient, she came
पेशेंट की
trying.
सोच से ब्लड पी रहा हूँ.
She got married just 2-3 months ago and she was only 7 gram. So she was 9 gram. She said अब मेरा तो पहले तो 7 ही था, तो लेकिन मेरे गांव का डॉक्टर इलाज कर रहा था, उससे मेरा 9 हो गया. तो मैं जैसे हंस रही थी, ऐसा कौन सा गांव में डॉक्टर आ गया. तो देन शी टोल्ड मी कि वो गुड़ का पानी पिला रहा था रोज उसको.
हाँ
इमेजिन, मतलब आई मीन
इंटेलिजेंट
कितनी
पर्सन.
अच्छी चीज है, कितनी अच्छी
correct.
चीज है.
Yes, yes, yes.
इंटेलिजेंट
Then
पर्सन.
there are things, madam. We have to be balanced, and yes, definitely, diet has it plays important role. Only thing हमें वो बताना चाहिए कि क्या कैसे. Yes.
Diet भी और
I,
deworming
I,
भी डॉक्टर साहब. If you do deworm,
हाँ,
only 20% patients का anemia खत्म हो जाएगा.
हो जाएगा.
absolutely. पूरा का पूरा, क्योंकि मैडम
सर
सबके मैंने
आपने आयरन फिश यूज करी है कभी? वो आयरन फिश जो आती है, अवेलेबल होती है, उसको दाल में डाल दो, उसको
हाँ.
मल्टी मल्टी यूज वाला. सर आपने कभी बताया
नहीं
पेशेंट को सर?
नहीं,
अच्छा,
काले
मैं
बर्तन
पेशेंट को मैडम डाइट लिख के देता हूँ कि आपको किस
वो बड़ा
प्रकार से
इंटरेस्टिंग है सर. वो आयरन वाली फिश आती है, आयरन की बनी हुई, उसको दाल में डाल दीजिए कुकिंग के टाइम, फिर निकाल के वॉश करके रख दो, फिर नेक्स्ट कुकिंग में यूज कर लो. थोड़ा
काली
बहुत
कढ़ाई में खाना बना
अनिता
लो.
रजौरिया, अनिता रजौरिया मिल नहीं है. आप अमेजोन में भी ले लो तो भी नहीं आता.
मैडम वो
अच्छा,
इसी को
काली
लेना है, फिर
कढ़ाई,
तो उसको लड्डू बना
मैम
के डाल
लोहे की
सकते हैं ना.
कढ़ाई में खाना बना लो,
लोहे
तो
की
आयरन की
इजी है.
कढ़ाई
कढ़ाई में खाना बना लो.
और क्या,
लोहे
पैन
की
पर.
कढ़ाई में.
हाँ,
ओनली
लोहे
थिंग
की
एक है
कढ़ाई.
जो डाइट का है.
रेणु,
नहीं, मैं
please,
सिर्फ
Yes,
ये
ma'am.
लास्ट
रेणु
एक लाइन
रेणु wind up.
बताना चाहूंगा
Thank you,
कि
everyone.
डाइट कैनॉट बी इन द ट्रीटमेंट ऑफ एनीमिया.
Diet is preventive.
Diet is to
Yes.
prevent the anemia.
हाँ,
In the
it's
treatment of anemia, it is the medicine,
medicine
and medicine,
and medicine.
Yes.
and that too injectable, and injectable.
थैंक यू सर.
Thank
थैंक
you.
यू सर.
Thank you, sir.
Thank
Thank
you,
you so
sir.
much,
Thank
sir.
you.
Thank you, sir.
Thank you so much, sir.
Thank you very much.
Bye everyone.
Thank
Bye
you.
bye
Thank
bye.
you. Bye, everyone.
Dr. Gorakh, I'm really thankful to you,
Thank you very much.
and thankful to all the joinees. And it had been a wonderful interactive session. Thank you so much.